Ferrari at breakfast on LBC. Call 0345 6060 973.
9 minutes before 8 is the time. Just waiting for the Health Secretary to get in position. So let's get Ralph in Peacehaven, who wants to talk about the lecturers' strike. Do you support the lecturers? Good morning.
Hello, Nick. Yes,
Hello,
no, I don't. I mean, what I don't understand, we have institutions like the Open University who can run a lot of this stuff with only 3 or 4 weeks lecturer interaction. That can all be done online, so we don't really need all these people anyway, because what are they doing? I mean, they're giving lectures, but are they any good? I mean, what is the value for money that we're getting out of this? And yes, if they go on strike, well, so what?
So the university staff who give open university education will still require pensions?
Yes, but...
So the argument... the argument would still be valid there. What I find strange is that when you consider how effectively for 2 years now some students have had their university education severely affected, some of us would say half wrecked, and I think it's extraordinary that they now decide that they want to go on strike right at the peak of this at such a time.
Well, I agree with you, Nick, but I mean, this whole system really needs a good overhaul, basically, to sort it out. So then we could possibly sort pensions out as well. But I really think it's quite stupid to say that if lecturers go on strike, you can't learn anything.
No, I agree.
Yeah.
And also, I don't know why, and I know some courses are longer, but by and large, the average duration of a university course seems to be 3 years, and that seems quite extraordinary. I have little doubt you could compress it into 18 months without anybody feeling any pain. You could possibly do it in a year, which would actually make the costs come down for all the young people as well, but it seems to be set in stone, doesn't it, for so long. Ralph, thank you for that. Let's come back to the idea of getting boosters into people's arms and whether you should fine as they are in Greece. Russ in Staffordshire, I'm sick and tired of being told to get my booster. I'm 45. I tried to book. The earliest appointment I can get is January. That'll be 25 weeks since my second. I'm told I'm now eligible under the new guidance. The government needs to get things moving if they're going to keep pontificating. Well, I think that was very much the message that was put across by the Prime Minister and the Health Secretary yesterday, actually. Louise in Berkshire, I had my first vaccine in May. I haven't been able to get my second until yesterday. That's extraordinary. Volunteers have told me the vaccine isn't accessible enough. I had Moderna first time, then I caught COVID. My original vaccine centre was closed down. I only managed yesterday. Well done. And you say it's a relief. I bet it is. Congratulations that you've done it and keep pushing on. This comes in from Michael. They're already a consequence of not getting the vaccine. If elevated risk of dying or getting seriously ill is not enough of a reason, then that is your problem. Sadly, Michael, I wish I could agree that it is your problem, but that's the whole key, because someone who does not is not just endangering themselves, they're endangering you, they're endangering your loved ones, they're endangering everyone else when they get on the bus, the train, their place of work, the cafe, the shop, whatever it might be, if they are selfish enough not to have the vaccine. Let's explore that now with Health Secretary Sajid Javid, who joins me. Thank you for coming on. Can we just clarify the vaccine boost, that the drive is on, but we're not absolutely certain that it will protect us, are we, from Omicron? Good morning.
Good morning, Nick. And please, may I first share the strategy with you, and that might help to answer that particular question.
Go ahead.
Is that, since we learned about Omicron, our strategy is really about buying time to give our scientists what they need to assess this new variant, but also to build our defences. And in building our defences, our best weapon still remains the vaccines, because although they may well be less effective, it's still likely that they're going to be effective against serious disease, especially if you've had your booster jab. And that is why I asked the JCVI, that's our group of expert advisors, independent group on vaccinations, and I asked them, in light of this variant, would it make sense to really expand what is already a very successful booster program? And they said we should do just that. And they came back with recommendations on Monday and told me that we should do a massive expansion. We should lower the age requirement to 18, so basically include all adults, and that we should halve the dosing interval from 6 months to 3 months. And that is a huge expansion. And what we set out yesterday was how we intend to do that. Now, the NHS has been at the forefront of fighting this pandemic for us. They've been doing an absolutely amazing job, especially on vaccinations. We are asking a lot of them, but I do believe that they are up up to this, and they are doing everything they can. So what we are planning to do, it is really ambitious. It's a national mission, is to offer a booster jab to all adults by the end of January, and it does mean that it's a huge task. It's going to be tough, but I think we can deliver on this. But what I would say to your listeners, if I may, is that when you receive the call from the NHS, please think of this as your bit in the national mission. Step up, roll up, and get protected.
What would you say, though, to what seems to be a number of folk who haven't even had their first vaccine? They say lines such as Health Secretary, I'm a fit bloke in my 40s, I'm playing rugby, or I don't need it, I'm only in my 20s, or I've already had it, I won't catch it again. What would you say, Mr. Javid?
I would say to them that all the science shows, all the evidence shows, because now we've had these vaccines in place for almost a year now. In fact, I think it was in a few days' time is the anniversary of when we authorized the first vaccine. Is that all that evidence shows that the vaccines work. They work. They make you less infectious, but just as importantly, they protect you against disease, especially symptomatic disease. They work, and that is why life has started to return back to normal. It's why we can get on with our jobs. It's because of these vaccines. And when you take the vaccine, you're not just helping yourself, you're helping all those people around you, including your loved ones.
The headline in one paper today, Omicron jab won't be ready for another 6 months, says one government advisor. Do you recognise that time slip?
Look, the truth is, Nick, no one really knows about such things. About first of all, what does Omicron actually mean? From what we do know from, let's call it a desktop analysis, we know it's got lots of mutations. We know that is concerning scientists about its infectiousness rate. It's about potentially its impact on vaccines. But the reason we've taken the measures that we have, such as red listing countries, the PCR test, the isolation rules, is all about buying time. And with that time, over the next 2 or 3 weeks, we will learn a lot more about this. And let me say something else, Nick. I've been clear about this, that if we do learn that it turns out to be no more harmful than Delta variant, which is the current dominant variant, then we won't need any of these new restrictions from the last few days.
But your decision is not to be taken to the next 3 weeks, I read in one paper today. Is that right? The next review is in 3 weeks' time, Secretary of State?
Yeah, just before Christmas.
Okay. And if people wanted to go away, it doesn't leave them a lot of time.
It doesn't. Look, people's plans, especially in terms of international travel, of course, they've already been impacted, and that, by the way, that's not just because of actions we've taken. We've seen many other countries behave in a similar way with travel rules and entry rules that they've just put in place. So, of course, that's had an impact on people's plans, and no one wants to see that. The way that we can sort of bring more certainty to all of this is to learn more about the variant as quickly as we can, and also work with our international partners. And that's why I hosted a meeting of G7 health ministers, an emergency meeting on Monday, to discuss just that, about how we can cooperate and deal with this variant.
Would you ever go down the path that will become law in Greece? You might not be aware of this, but as of next month, fines of €100, which is about £85, will be imposed at monthly intervals, so you'll pay each month, for those people aged 60 or over who don't get their vaccinations. Is that something you would consider, Secretary of State?
No. I think that, one thing I've learned on this job is that we know vaccines work. I want people to obviously take their vaccine if it's offered to them, but it has to be a positive decision. You have to encourage people to take a vaccine and give them the information that they need and work with them. With some people, it might take longer than others. The only place where I think it should be compulsory, and I've been very clear about this, we've talked about it, is in the NHS and social care. And the difference there is because you are in a profession where you're working with vulnerable people, and it's about protecting your patients.
I've referenced Christmas, just coming back to that. Who is right, Jenny Harries from the UK Health Security Agency when she suggests we should minimise contacts, or Boris Johnson, the Prime Minister, who says we should go ahead as normal? Who's correct?
We should. There's no need to change our plans unless they've been affected by the new rules we've put in place. So if you're asked to self-isolate, for example, because you've come into contact with someone with a suspected case of this new variant, then of course your plans are going to be affected. But other than that,
so the scientists
just follow the guidance.
The scientists were wrong.
Follow the guidance that's already there, and in that guidance, we've already said, long before we knew about Omicron, was that in the winter, as each day gets darker, a bit colder, The virus likes that. The flu virus likes that. So just, have a bit of common sense and, follow the current guidance. And the vast, vast majority of people do just that. They know about the risks and threats that are out there, and they behave responsibly.
OK, one newspaper, the Daily Mirror, asserts that the Prime Minister did not behave responsibly last year at a party in November the 27th and subsequently in December the 18th, when you will recall parts of the country were under Tier 3 restrictions. Were you aware of those parties? And did you attend?
Well, I didn't attend. I don't remember attending those parties, but I don't even think there were parties that I'm aware of. But the point is, whether it's in Number 10 or any government department, all rules would have been followed all times. And I have no doubt whatsoever that within Number 10, especially in Number 10, that they would have followed all the rules at all times.
November 27, dozens of Number 10 staff, including the Prime Minister, crowd into a small room as an aide leaves. Christmas party on December the 18th, 40 or 50 staff hold a boozy party with a secret Santa. Don't tell me you were NFI, Secretary of State.
Well, look, first of all, it's the Daily Mirror. You've got to keep that, you've got to take that into account.
I'm sure they have their facts straight, Secretary of State.
I'm confident that all the rules would have been followed at all times. I don't think there's anything there.
Lastly, my newly made friend Wes Streeting, who's 38 years of age, says he hasn't had his booster and he wants it. What can we do, says Wes. What can we do for Streeting? Secretary of State.
Well, I like Wes, and I want to wish him the best of luck in his new job. But he can't jump the queue. He might be the Shadow Health Secretary, and he might have been the Shadow Health Secretary for 24 hours.
At least 48 hours, I think. They do like to roll him round a bit. Yeah, go on.
That does not entitle him to any kind of special treatment, so he's going to have to wait his turn. The good news is, because of the measures that we've taken in the last couple of days, he's not going to have to wait long.
Good having you on the show. Thank you, Health Secretary Sajid Javid, appearing here on LBC. Where 3 minutes after 8 News is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the Health Secretary, Sajid Javid, has told LBC that new coronavirus measures are all